Hello, everyone. My name's Randy Cook, and I'm excited to welcome you to the inaugural video podcast, videocast of Prescriptions for Success. We have been audio only for somewhere around 9 years, I think, and we have finally decided to move along with the rest of the world and get into video. And so we're excited to be coming to you today, both in voice and with living color pictures. I'm excited about our guest today, Dr. Desmond Bell, who has been a guest on our podcast in the past, way back many years ago. He was in episode number 19. He has practiced as a podiatrist for many years. During that time, established a very nice, very effective and helpful nonprofit called Save a Leg, Save a Life. He has left clinical practice and moved into industry, but he continues to have an interest in wound care and limb preservation. Des, so good to see you again. And thank you for bringing us our other guest today, Mr. Shayan Mashatian. And I'm going to ask you to tell us a little bit about him, and you'll be in charge of the introduction today.
Well, thanks, Randy. It kind of feels like old home week, and I can't believe it's been 9 years since Prescription or RX for Success.
How much older you are.
I know, and I'm still as immature as ever. So it's just great to be with you again, my friend. And I'm really honored to introduce another friend of mine too, Shayan Mashatian, who I've had the good fortune of really getting to know over the past year. Sometimes the universe steps in, as you know, and you pay attention. And Shayan is really, he's quite humble, but he's truly a genius. And he is the developer of a platform called WoundScribe AI. Really began as really a patient focused app called Pingoo. And Shayan will tell you all about that. But we connected, and I saw the value in what he's created. And I am now proud to serve as the president of the company and work with him daily throughout the day, pretty much 7 days a week, or at least 5 or 6 days a week. But it's really a pleasure. I get to learn from him. I get to share some of my clinical knowledge and tell him, or really introduce him more about the wound care community and the wound care world. So really, I think you're in for a real treat. You're going to get to meet a really amazing man, quite a history, and I'll just be quiet from here.
Well, Shayan, I want to congratulate you on making the acquaintance of Desmond Bell. You couldn't have a more capable partner, I think. So welcome to our show. I want to begin by finding out a little bit about you, things that I'm curious about. You describe yourself as a technologist with a passion for social innovation. What exactly does that mean, if you don't mind sharing with us?
Sure. Thanks for having me, and thanks, Des. He's too kind, and I'm humbled to hear how he describes me. Technology for social change. As a technologist, I have this kind of famous quote that I say, technology is dumb, is bunch of zero and ones string together, and it really doesn't matter. It changes anytime you think about it very fast. Mm-hmm. What really makes technology interesting is how we use it for change. And social change, of course, I guess is on top of mind of everyone. And that has been over years really my interest, how we can use this tool to create better life for everyone. The rest of it is technical details that really doesn't matter.
Well, Shayan, as we always do, I'd like to get a little bit of background on you because, after all, this show is intended to be about the entire arc of one's success. I know that you were born in Iran, and I'd like to know a little bit about how you decided to move to the West and what it's been like for you making that adjustment.
Absolutely, yes. I was born in Iran. I finished my undergraduate studies there. By accident, I became the manager of executive director of first internet node and ISP in Iran back in late 90s.
Wow.
Yes, I was working actually as a manager at a research institute, which was in bringing books and magazines and supporting different research departments. And it was all math and physics, nothing even engineering per se. But at that time, we were ordering, if you remember, those microfilms for past issues of different articles that different professors at university they wanted. So we would order those microfilm for them in our research institute, get them printed for them so they could come or read it on those big monitors if you have seen any of those. And then so through that, we were in touch with many publishers in Europe. And one day, one of them said, and we had computers, networks at that time, PCs. And one day, one of them told me, there is a new device. It's called modem that you can install it on those computers you already have. And you can connect it to a phone line and you can get this article. So you don't need to order, shipping, mailing, all those. So we said, that's interesting. Let's try. And we got that. And it was first modem in the country. We connected. We heard all those weird voices, sounds that connects to a phone line. And we saw this text on our monitor. So that was kind of a magical moment. Internet was not born as we know it at that time. We had isolated networks in Europe, in US. Later, the university networks in US connected to European network. And then first it was called Trena, then it became internet. So I was lucky just to be in the heart of that huge change and new wave of technology. So it kind of also Iran, is a developing country, a lot of talent, very passionate about ambitious and passionate about modernism and be a modern country. And this kind of was the climate for all of us, be in the heart of technology and latest and greatest. And after doing that for a few years, I was thinking, I need to go and see the world. I need to understand how this technology is developed at first place. We are just importing it. We are applying it. Yeah, we do some localization. We try to adapt it, but how is it done? That was really out of curiosity. And I thought
you were just curious about what was going on elsewhere.
Life was good. I was doing good, the very fun things. I was lucky to see the most intellectual people in the world. We were having a lot of scientists. We had also computer science, cognitive science, philosophy of science. So we had a lot of professors from Oxford, from US, from all over the world coming. And I had the opportunity to meet with all these wonderful people, the best talent of our time. But at the same time, the opportunity for migration was there. And I remember that I thought, what, if I leave and go, what I need to start over. I knew it's a start over. Whether I stay, okay, really? Continue. Yeah, then I thought, what, let me think. If when I'm 6 years old or 7 years old, toward end of my career, would I regret if I wouldn't? And the answer was an absolute capital yes. So I need to go and see the world. So that was really my motivation. And I came to Canada first and then started. That project was very much entrepreneurial without knowing what entrepreneurship is and any of those. And yeah, that was kind of the way I came. And then another 20, 25 years now since that time has passed.
I don't want to oversimplify anything, but you've just done a tremendous amount of stuff. If I can possibly oversimplify things, so many different products. I'm curious always, I'm just absolutely astounded at how people can grow up in a particular area, accustomed to a particular society and sociology, and just decide that they're going to pick up and go and drop themselves someplace else. I've had lots of guests on this show that didn't really have any choice. They escaped from Vietnam before fear of losing their lives and things of that nature. But I wonder if you could talk a little bit about the presence or absence of that culture shock, if you will, and what kind of effect that it might have had on you. Was it intimidating? Was it inspiring? How do you think it helped you get to where you are?
Okay, my answer might surprise you.
I hope so.
I came to Canada first. I came to Toronto, and you know how lovely is Canada, and it's home, and I love living here and everything about it. But the perception we have in Iran, at least at the time we grew up, from West was something like Paris. Like it was very much European. And there could be many reasons for it. When Iran was going through modernization, French, expert came, created educational system, all the legal system. So it was really very much influenced by that culture. So when I came to Toronto, I thought I go to kind of Paris and I go to street, I see these cafes, Hemingway sitting somewhere writing his next novel. And Tehran when I left, it was like a 15 million people city, a metropolitan, right? Every day when you go out and go home is a journey, right? You meet countless different people, different interactions. It's very inspiring. So, and I felt I just came to a very big, nice village in Toronto. So that was
right. I love it.
So yes, I mean, then you start looking into really differences, right? One thing when over years, when you compare your immigration experience with others who went to other countries, later I realized how Canada and US, later I moved to US. I went to Africa, China after that for different projects. I spent some time in those countries too. But what is really interesting, and for a long time I didn't notice how Canada and US are welcoming to immigrants, right? Seeing people from different places, different countries, all different backgrounds. It's so normal that when, I remember you walk in the street, Toronto has this famous Yonge Street that they say is the longest street in the world. You walk around and you don't feel you are a stranger. You feel it's my city, it's my street, it's my shop, this is my coffee shop. So that sense of belonging and connecting is very real and available. Later, I heard from my friends who went to, for instance, Europe, because the social structure and everything is different. They didn't have that exact experience. The adaptation took longer for them to be part of the society. So
that's interesting.
Yeah, I mean, to be honest, the culture shock was a bit more the other way around for me. So I expected a lot more. Later, I went to university. I got more exposed to different life experiences. So I started seeing all different aspects of society here. That I learned a lot. But to be honest, the shock was the other way around. Even when I moved to US, I started entrepreneurship. I started a company. It was acquired. I went to US. I'm like an engineer, right? You come and tell me, Shayan, this doesn't work. What the hell, right? And I say, okay, tell me, what did you do? What was the steps? I fixed it for you, right? And I talked to our engineers same way. So, but when I came to US, started working with different clients, I realized how much politics goes into everything. So if I need something from you, Randy, I don't say, Randy, I need this. I say, Randy, how are you? How was weekend? How is your dog? What did you do? And do you remember XYZ? It's very important to do it. Thank you for a great job. So it's like so much things happening until I tell you I need this today. Can you do it, right? In our culture, or sometimes we call it a German culture, we say, hey, Randy, I need that by 2 by. That's like, so that was a little bit, again, more adaptation. And I say again, I don't undermine. It's good to have nice environments, very friendly, and have those context and background. But I mean, if you talk about adaptation, it's been like understanding those context culture so people don't misunderstand you. If I'm directly asking you something, I'm not rude, I'm not, aggressive or anything like that. I just want this, I just need this, that's it. Right? Those are the things.
Very interesting.
Yes.
Very interesting. I don't know if you described yourself or if someone else described you this way. So I apologize if you've never even heard the term before, but someone has described you as a serial entrepreneur. You heard that one?
Yes.
And do you feel that describes you aptly? And if not, why not? And if so, why so?
I guess part of it goes back how you see yourself and how you need to position yourself, others see you, right? And it's like these titles are, very superficial social constructs. They really don't mean that much to me.
Indeed,
but it kind of reflects a bit what people should expect from you. So in one sense, yes, because I have been creating different companies, working on many different projects, and they have been usually start from an idea concept all the way to build something legit. And in that term is really, you can say is a serial entrepreneurship because I have repeated this over and over. But if you ask myself how I think of myself, I think I'm very interested in wicked problems that don't have an easy answer. And my wife asked me, said, why do you do that? You start thinking of a problem that no one is really maybe noticing, or some people notice it. Then you think of a solution for it. Then you go and build it, and no one knows how to build it. And then you try to go and convince people, hey, the problem, maybe you even don't know what your problem is. You see some symptoms, but you don't know what is your problem. I have a solution. Why you just don't do something simpler? I said, I don't know. That's now this is the link with entrepreneurship. I guess that's what we do as entrepreneurs, right?
Brilliant way to think about thinking. I mean, what you have described to me is the best definition of thinking outside the box that I have ever heard. Wouldn't you agree, Des? I mean,
this is the essence of this man. I will tell you that. That's one of the things that I really have enjoyed about working with Shayan too, is his approach to things, how he sees things. I don't consider myself to be much of a conventional thinker in many respects either. So, we love to problem solve. Really, at the end of the day, that's one of the things we truly have in common. And all this may not do it the same way, but it's really been a pleasure being around this man.
Yeah, I bet it has.
Sorry, I thought today we talk about WoundScribe. I didn't think I will be interrogated today, so I would prefer differently.
I wouldn't use the term interrogated. Exactly.
Yeah, this is just casual conversation, my friend. Well, it's easy to see how just based on the short conversation that we've had, it's easy for me to see how you have managed to bring so many different ideas and different products successfully to market. I've always wondered how that came about, and you've given me some really effective insight, I think, into how the process works. We could probably talk for hours and hours, and I know nobody's got that kind of time, so I'm going to sort of jump to the chase here. I know a new thing has come up both in your world and Des's world, which have sort of combined this project called Pingoo. You want to tell us about Pingoo?
One of the companies we made and started was a precision health platform, or as you know it, taking DNA tests, telling people how your body responds to different food, exercise, drugs. And we built that with some background I have in education. I was head of innovation at largest education tech company in the world per revenue. And we were using AI and personalization, how to create personalized education experience for everyone. Personalized education been around the topic for a long time. We all have different background. We learn at different pace how we can really make this optimum. That's like a very high level description of personalized education. So with that background, we were doing this DNA test. We were giving like 400 reports to different people. And it was difficult for anyone, even for me, to remember all of these reports and understand them, and most importantly, apply them and use them really, right? And that was kind of on my mind, how we should solve this problem. And I presented our platform at a seminar conference, and Dr. David Armstrong, he is the president of American Limb Preservation Society. He mentioned, we can use genetic for diabetic foot ulcer. It's very important because how every 20 seconds is losing a leg to this condition. And I was blown away, and I had no idea that that's such a huge problem. They call it silent pandemic. No one talks about. And it also triggered me. And he said by education, early in intervention, we can prevent maybe up to 85% of these amputations. So just imagine, just by education and good engagement, we can prevent this for many, many people. So, and then it was in my mind how we should do this until pandemic happened. And everything was slow. We couldn't sell our services. And like many of us, I started learning a new language. I thought, how about learning a bit of Spanish? And I got Duolingo. And it was almost same day. I said, why we don't have a Duolingo for health education? Why we don't make it micro-learning? Why we don't do gamification? Wow. Why we don't do it in a way can insert into our daily life instead of I put 1 hour aside. I had used Coursera. You have this, mind barrier. I need to put 1 hour aside, relax, sit, watch this 1 hour video, then answer quizzes. Compared to all this micro learning. Anyway, that was how Pingoo was born. And as you can see, it has on its website, it has a cute penguin icon. And we started building it with that in mind. Also, I wanted to mention why Pingoo. I was thinking what to call this product, right? In a startup world, you can always go with coined names, or you can go with some self-descriptive names that speaks what is this about. I remember when I was a very young teenager, I watched a documentary about penguin emperors in South Pole, that how they travel maybe 17 miles toward the center to nest their eggs, because the ice needs to be thick. They hold it and they come back. And these species have survived, for millennia by doing that. And they turn, to go eat, come back, hold it. And I was looking at it, and I remember it was like maybe National Geographic documentary. It has like a iBird view of how they are going, and there's like footsteps there that is on ice that they go back and forth. When I was thinking about Pingoo and micro learning, I thought, what? It's really one bite of knowledge at a time. It's like you take one step at a time, and that doesn't mean that much, right? But when you look back, you see how you have gone a long way and you saved a species by taking those steps. So that was also a bit of how I thought about it. Education doesn't need to be a heavy thing. It doesn't need to be, I have a wound app to open to think about my wound, then go there. So that was a bit bringing all of these different contexts and experiences together to create an app that better engage. So we launched it. Partly it was pandemic, people home. They didn't have a lot to do. So we got more than 200,000 downloads, but we managed to get people, some of them up to 1 hour in the app every day. So that was very interesting to watch how by creating the right design, right content for the people, they really engage. But then how to apply it to a condition, make it more personalized, do it for diabetes, and the rest of it then came how to make it more tuned toward a specific group of people instead of just a general health and wellness app.
And just to bring me up to date, I'm not sure. Is it fully developed at this point? Is it
yes.
on the market? Okay.
Yes, it's been live since 2022, 23, and that's how we have been getting. So we had iOS and Android.
Shows you how long I've been out of clinical practice.
It was a general health and wellness, not, and later we changed it a bit, even expanded it, not just health and wellness. For instance, I don't know, stress management is one thing, sleep is another aspect of our well-being. But also if someone has financial distress, they don't have a job, they are all impact our health, right? So we started expanding to those topics. So people go there to learn overall. It's more towards self-development. Mm-hmm. And funny enough, we have a topic about friends. I know friends is probably not for the younger generation, but we had also these, topics answer. It's like kind of flashcards, swipe and says, did Rachel live with, or Monica live with her grandma or not? Yes or no? So, and interesting enough, those kind of topics sees a lot of attention. People like to have a bit of break while they learn new things, right? So there's been a lot of usability, psychology, micro learning in coming together for that app.
Des, I got to think if you were still in clinical practice, I should think you would be pretty excited about Pingoo, would you not?
Well, so Randy, what the Pingoo part of the WoundScribe platform to me is just a natural fit, and it addresses a huge need. Mm-hmm. And that is, the patients are part of the wound healing team, but a lot of times, yes, but we all know the frustration of explaining something to a patient or them being labeled as non-compliant because they didn't follow instructions. But the reality is a lot of times they're overwhelmed. They don't comprehend whatever it is. So what Pingoo does, it gives that reinforcement for after the clinic visit. You've got the ability for the patient to see a note or synopsis of what their doctor explained to them. It's got all this other health information about their own condition that they can learn more about. So the more they're engaged, the more they're going to be compliant, receptive. And I think what this is addressing is that one of those missing links, and we all know that recurrence is such a big problem in wound care. And we wrestle with, well, why did this wound come back? Or how do we prevent recurrence? Well, if you get the patient trained or get their mind trained to become more proactive instead of waiting for problems to happen too, it all ties together. So, Shayan took this concept of, almost applying that Duolingo gaming mindset into this health platform that is really pretty remarkable, but now then tying it into the WoundScribe platform, the whole end-to-end experience of what happens during an encounter and how it affects both the patient and the clinician. That's why I said it's genius. And when I first saw it, I was so impressed and said, this is going to fill multiple needs for all of us, not just the clinicians, the patients, and even the payers.
That whole idea of making the patient part of the process and getting them completely involved has got to be one of the most brilliant things of the entire idea. I think I know, Des, that you'll confirm that the most difficult thing that we face in healthcare delivery, I don't care if it's wound care or measles, it's getting the patient involved, getting them to be part of the process. And Shayan, this sounds like exactly what you have done here, and I'm really impressed.
Thank you. And later this generative AI came in, and we also work on that. We have a paper that's how we extract medical knowledge in a chat context for each patient. And now when I want to introduce Pingoo, I say, imagine if ChatGPT and Duolingo had a baby. So that's kind of Pingoo. Because now we combine that micro-learning with reliable, trustworthy AI chat. It doesn't give 2 pages of an answer for a question. It's very concise, reliable, verified, and contextualized for that person. Yes, that's basically, we think it fills a gap. And that, if you would like me, I can explain how it evolved to WoundScribe, or we can get to it later.
If you have the time, I would love to hear it.
Yes, absolutely. When we started looking into how we educate patients, so one part is general education. If I am diabetes, what should I do? What are the must know and question I have to get answered? But how about my diabetes? How about my wound? How about my condition? And we wanted to take it one step further, and we realized most of the content that patient needs to know and get is coming from their conversation with their doctors. And we started looking into it, how we can capture this, and we arrived at the idea of what is called scribing now, and went to the name of the company. We built one of the early scribe technologies before it becomes hype and very, on demand. I remember I went to Health HLT conference. I was telling people, hey, we can do this. And they said, yeah, let's see. Everyone was very skeptical about it. But basically, we started recording the conversation. We started validating it, organizing it, and convert it to plain English for the patient who can understand it, not medical jargon, none of those. So that become actually another component that we said, let's do it. Still, we wouldn't call it WoundScribe. It was still diabetes and diabetic foot ulcer. Then we realized, okay, at the end of the day, it's about how we can get this wound healed faster. And to my surprise, I realized that wound size, imaging and size of the wound is one of the most important part of it. And that problem is not completely solved. And I was really surprised because medical imaging is a very established field. If you look at FDA, number of different products and software they have approved, more than 70% are in medical imaging because it's easy to validate, right? And see if it really measures well or any other claim they might have. But still, we talk to people, they say, oh yeah, we use XYZ technology, but only we have one person who knows how to use that and hold the device. Or other companies say, oh, put this, order these markers, print them, put them on, patient body next to wound so we can measure. So we started looking into it. So we built a technology. And I, as an outsider to medical field, I say, I just use my mobile banking app. I point it as on a check. It finds the border. It zooms in. It's not blurry. If needs, turn on the flash and capture it. Why we cannot do that? We should be able to do it. So we did that. And then we realized, okay, when we go to clinicians, this is good. Patient education takes a lot of time. We address that. Measurement is good. Charting is almost there, but they need also all the codes, all the rationale for their insurance claims, because scribing what was the conversation is one thing, all the assessment and plan physicians made and why and how it will be reimbursed is another thing. So we did that too, but at the end of the day, let me tell you another funny story. David, I consider him as my mentor. When I wanted to work on this, I traveled with David to almost every diabetic conference, food conference in the country as much as I could for a year.
I bet that was calming.
If you would ask my 20 years old studying math and you tell me, 2 decades later, you end up with David Armstrong.
Following David Armstrong around the world. Oh, yeah. What a great idea.
Yeah, exactly. But that was the thing. We do this in our entrepreneurship startups. We do client discovery, we call it, and we go and ask people, what is your pain point? And one of the questions I would ask everyone like that, I would say, what is the most important decision you make in your treatment plans when you decide a treatment plan for the patients that you have the highest uncertainty? And most of the people, almost everyone said for diabetic foot ulcer is a treatment called oxygenations. Because of lack of oxygenation, this wound start and they use these devices to pump oxygen. And they said, we do oxygenation and sometimes patients respond, wound starts healing faster, sometimes they don't. So we have two choices, either refer the patient to a cardiovascular surgeon for under surgery or wait. If we refer them too early, is an unnecessary surgery. But if we wait too long, wound becomes systemic. And so at the end of the day, the juice of all these clinical decision support system or whatever you want to categorize them is predicting treatment effects. so would this treatment work for this patient or not? And if you think about it, like if you ask Des, probably he says he has the whole medical knowledge at medical school and he has years of experience. So he sees Michael, he brings all of his knowledge. Des, correct me if I'm wrong. And then he also thinks, you know what, Michael looks very much like Joe with the condition and profile, and his condition, probably XYZ condition, would work for him, or with some tweaks here and there. So this is a very interesting time because so far we haven't had this all technology to do this effectively, right? We have, if you go to any wound conference, still size of the wound, and if it shrinks by X percentage over 4 weeks, is one of the main factors.
That's
that
the
if you say,
yeah.
Yes, and but just think about it. We know glucose fluctuation will impact wound healing. We know malnutrition impacts it, and we never had continuous glucose monitoring. We never had all the technology, not only combine many layers of data, do it over time, and have this continuous system that can analyze this complex set of system, which AI is now there and doing that. And on the other side, with the AI, again, I'm very cautious to use AI because not every data driven system or a statistical analysis AI should learn. There should be a feedback loop in simplest term. And what we have done at WoundScribe is that we actually have built a clinical decision support system, which is a learning health system too, which means we not only continuously feed the latest and greatest research and finding into the system to see, instead of waiting a year to go to next CME and see who has find what, imagine it continuously come to your system, and with every interaction it learns, right? We draft this trajectory or what might be the condition for the patient, what could be a possible plan, and this looks into it and say, oh, I agree or don't agree, and we see over time these decisions work or not, and system starts learning. This is the golden opportunity that we can really change paradigm of care and make it truly personalized. So physicians benefit from it, payers benefit, patient most importantly benefit. So it's really a win-win-win-win for all the stakeholders involved. That's how WoundScribe has evolved. So as you can see, it wouldn't take a genius to see it. It was just one step at a time. We found this is the next blocker, we need to solve it. So we added, and then it became this comprehensive platform.
Well, I think maybe it does require a genius, and those are kind of rare. So I have great respect for what you've done. I'm just overwhelmed with how simple you make it sound, and how you have succeeded in going truly straight to the problem and fleshing out solutions that really make a difference, rather than sort of, as we used to say, throw something at the wall and see if it sticks. You've got something here that actually gives you an opportunity to make some progress, and not only that, but gives you some feedback on the kind of progress that you may or may not be experiencing. And I'm just overwhelmed. It almost makes me want to get back into clinical practice, but
Randy, you know, Randy, when Shayan showed me this the first time, the first thing I said to myself was, I wish I had this 15 years ago or 10 years ago.
Yeah.
You know, the whole AI part of it struck me. And I said, you know, this is going to address one of the real, I don't want to call it a dirty secret of wound care, but the fact that we don't have formal training in wound care. You know, we all come from different backgrounds, but there's one fellowship that I know of. So everybody's learning on the job. And so what happens is you draw on your own base of knowledge, or you attend a conference and you confer with colleagues. But, you know, at the end of the day, you're still drawing from your experience. And what I saw what Shayan had put together, it's like the first thing I said, this is only going to get smarter. This is only going to get better with more use. And it's going to help that decision-making process, because now the clinician, maybe let's say somebody who's less experienced, is going to be able to benefit from the experiences of others more experienced in the profession or in the specialty. And so that's a win. But then I also saw the time savings of the, in the workflow in the clinic. It's soul crushing when you're charting and documenting 4 hours a day, 2 to 4 hours a day is an average for me.
Yeah.
And so now to have that ambient listening, to have the image taking, which is a consistency issue, that's resolved. To draft your notes that are now audit ready, but they're not just soap. You can get a soap note, you can get a nurse's note, procedure note, and a note for the patient too, through Pingoo. So it's like, this is really incredible. This is a full-time assistant that you can carry around now on your iPhone, basically. And this is just so far ahead of anything we've had. So to me, once the word gets out about this and people start to have experience with it, I think the sky's the limit with this. Like I said, at the end of the day, it's going to get better and better too.
Des, one thing that went through my brain as I listened to this really brilliant presentation is how much time has been consumed from clinicians who were making an effort to acquire information, acquire data, organizing it into a way that makes sense and is useful to them. And it just has not been there for us. In fact, I vividly remember, and I think you'll share my frustration with this, when the electronic medical record came along, and unfortunately was immediately pounced upon by the profit makers and the profiteers. And rather than becoming a tool that actually helped us and saved time for us, it was just a brain drain.
Yes.
It was just sucking the time right out of our lives. And this thing that we've come up with here is, it's the polar opposite of that.
So you're spot on, and you get it. We've been around long enough to have been in practice before EMRs came out, and then they became something we all had to, were burdened by. And we, part of your day, a good part of your day each day as a clinician, you're a data entry clerk. And that's all you're doing is you're entering data into a repository, and you get really nothing out of it. In fact, even a lot of that data that's in there is only going to be held against you somehow, potentially. But there's nothing that your patient is going to benefit from per se, like, with this constant learning platform that we have here. So, at the end of the day, I used to say to myself all the time, okay, those 2 hours, those 4 hours that I spent charting today, I could have seen how many more patients, or I could have done a couple of surgeries, or I could have been home having better balance in my life too, mm-hmm. and spending time with my family, or, just taking care of myself a little bit better. So, we're giving docs their life back in a sense too. And yet the patients are benefiting from more efficiency.
Yeah. Best example of a win-win that I've seen in a very long time.
Without question.
Shayan, I have really enjoyed this conversation. And I know we've taken up a lot of your time, and I appreciate you sharing it with us. But I got to tell you, this has been one of the most fascinating conversations that I've had in quite a long time. And I'm really grateful for you being here. Before we go, I want to give you an opportunity to share a little bit more wisdom with us. And I'm going to close my mic. And audience, Mr. Shayan Mashatian is going to share his personal prescriptions for success.
Sure. Randy, I just wanted to mention one part about how we could make this. A lot of credit goes to our clinical partners, Stephen, Lucian, our chief medical officer, Sarah. These are all clinicians that they have been really informing what needs to be done and validating. This is a continuous validation that there's also joined and leading those efforts. And before I share my personal success, I just wanted to recognize how special and different work they do. As a clinician, you are trained to manage risk, to don't risk your patient's life and conditions, right? And now we are facing this whole new wave of innovation that makes a lot of claims. This AI understands better, tells you things you couldn't possibly physically know, right? So this is really a very, very complex task for a physician. As they care about their patient, they don't want to put them at risk, still use the best technology for them. Me as an entrepreneur, I would like everyone use whatever I make next day, right? That's what I want to see. But as a patient, I don't want my doctor try whatever comes out on me first, right? Still, I don't want to live like someone who was living 100 years ago. And kudos to clinicians, physicians, everyone who keeps an open mind to understand these technologies and how to use it and provide feedback. And those who are brave, they come and they put a lot of effort to make sure this works. So this actually takes really my role into the picture of this project. I call myself a chief glue officer. These are really more than multidisciplinary team, is interdisciplinary. We have our data scientists learning about wound. We have our physicians learning about AI and coding. In a multidisciplinary team, people work alongside. Here, everyone goes to each other's space, learn a bit. Sometimes I listen to myself. I'm talking about wound. I'm surprised. Who am I to talk about wound? But I had to learn. I had to know the basic, right? So I just wanted to recognize the extremely important work they do. And that's because of them that this system really works, and other clinicians like it, and they give us positive feedback. That's definitely on them.
Very, very generous of you to keep that in mind.
Absolutely. So I guess you had shared a couple of items I think are important in life.
Please.
So again, success is a very subjective concept, and I don't know how even to define it or say, but I can say what has been really contributing to my motivation over time, and I found them valuable. I thought of three things. One is really on top, maybe, is volunteer work. When I look back and I think about really turning points in my life, that and I see them as if a new horizon was open to me, so I see things differently. They have been almost all of them, I would say with no exception, through volunteer work. And I think volunteer work is very much underrated in our society, right? Just imagine a few people come to an organization with no hierarchy, no manager, no boss, with a passion for a cause. They work it out. They learn from each other. They go toward it with almost no expectation for personal gain, right? At most, they say, I gain experience. I think whatever we talk about volunteer work and its importance is less. And it's not a matter of at what phase in your career you are, you're starting, you're in the middle or whatever. So that, I would say, that has been the most rewarding and contributing factor in whatever I have done in my life. The second, I think, especially with all these rapid changes in the society, is keeping an open mind for adaptability and adaptability. So change comes and we constantly need to reskill, upskill, learn, and fit into the system. You mentioned Iran. When you grow up in Iran, in a society that not everything is very well defined, so you always find yourself navigating the system, predict what might come up that you had no idea, from driving in the street starts until ever-changing regulation, and everything is always changing, right? So you learn to adapt no matter what. So I think that now it becomes like a skill, like you just practice it over and over. And when you face other challenges that you didn't expect it, suddenly pandemic comes, the whole world stops. So you need to adapt. So I would say keep an open mind to that. That's definitely important. And the third concept, I have been a bit struggling myself to what is it really, overall it's called resiliency. That's, you keep going as much as you can. You find ways. It can be also related to adaptability when you face a problem. So a lot of things comes into it, not being afraid of failure, at the same time understand when it doesn't make sense and change direction and pivot. And a startup and entrepreneurship is really a good platform to have both. Show resiliency, keep pushing to make things happen, because you hear 99 no a day and 1 yes. At the same time, know when you need to change direction, when you need to really understand that you need to have a U-turn or any pivot you need to do. So those are the three things I would say, I guess it's valid continuously. You need to keep in mind. But yeah, that was when I thought first three things came to my mind was these three. So I just shared those.
A lot of wisdom there, and I'm not surprised. And I thank you so much for sharing with us today. It has been a pleasure having both of you guys on the show today. Shayan, before we go, I will give you an opportunity, as I will to you as well, Des, to share things that you might want to share, websites or email addresses or upcoming presentations you're going to do or whatever you'd like to share with the audience. Go right ahead.
Yes, I guess, WoundScribe is our focus, and the work we are doing, we are passionate about it. WoundScribe.ai, and my email is Shayan@WoundScribe.ai. I would love to hear what everyone who can benefit from it think about it, and hopefully we expand it to other conditions in future. But yeah, I would say that's really what we are focusing on now.
Besides WoundScribe.ai, I'm also still busy with Save a Leg, Save a Life. So the salsal.org. We'll be at any number of meetings. Our board members will be presenting at any number of conferences over this next year. And you can go to our website and find out more what we're doing in terms of the White Sock campaign against PAD and some of the other things that we're always working on. But again, right now the focus on is with WoundScribe. Again, WoundScribe, WoundScribe.ai, and you can get a firsthand glimpse of some of the work that we're doing there. So it's exciting. I can't wait to really talk more about this with you personally, Randy. And it's just it's going to be a fun ride.
Terrific. Well, all right then, Shayan Mashatian and Dr. Desmond Bell, it has been a lot of fun speaking with you today, and I thank you both so much for being with us on Prescriptions for Success.
Thank you for having us.
Thank you, Randy. It's a pleasure.
Thank you so much for listening today. If you enjoyed the show, you can help us reach more listeners by leaving a rating and a review, especially on Spotify or Apple Podcasts. You can also help by becoming a Patreon member. That link is in the show notes. And we hope you'll also follow our companion podcast, Life-Changing Moments with Dr. Dale Waxman. Special thanks to our producer, Craig Clausen, our promotions manager, Mariana Rodabaugh, and to Ryan Jones, who created and performs our theme music. And remember, be sure to fill your prescription for success with my next episode.